So we're just doing just like a basic like dressing application? Perfect. Okay, so let's pretend that this is the spine right here, right? So the incision is just going to be running down the middle of my arm here. So you're the guinea pig. So we're going to see a couple of different sizes. This might be one of them. So this is a 10 by 30. More commonly, it's a 10 by 20 just because the incisions are about sometimes like that long. And this, while you could use this, it's a little bit overkill. So the 10 by 20 is about, maybe give or take, looks like this. So every dressing functions exactly the same, so don't worry if they're different size. Okay? Yeah. So what we're going to do, I'm going to hand this to you, and we're going to put this on my arm here. So each one has like a little peel off in the back, right? Let's peel it off. This is going to go directly over the incision, whether it be staples, sutures, glue. Yep. Yep. Just put it right in the middle. Yep.
I have a question.
Yes.
There are some that the patients had it on, and before you remove it, you have to turn off the machine.
Yes. So you can. So the device actually has just one button on it. It's a big orange button. So you can just pause it, and then it has like a twist lock. All you do is pause the machine and just untwist it, and then you should be good to go. Then we can just put the device just on the desk or something like that. When we put the new dressing on, just reconnect it to the new dressing and press the button again to start it, and that's it. Okay. So yep, that's correct. So another thing worth noting here. So when we apply it, this is okay for purposes of my arm, but when we apply it, we want to make sure as best we can to get rid, I know that sometimes there's going to be little folds and creases in the side, that's okay. But make it as flat as we possibly can. So this edge right here is kind of what we're going for. Make sense?
Yeah.
Okay, so another thing too, every dressing, no matter what size, is going to have this little soft port here, right here. So what this is a sensor to communicate with the device to the dressing that if it becomes saturated with fluid, the device is going to blink orange. Okay? So the reason I'm saying that is when we put these on an incision, especially the spine where it's straight up and down, north-south, right? We want to do our best to remember to put this as pointing north, because if we flip this around and this is down here, everything's still going to work. Like we're still going to get the suction and compression and all that, but whatever fluid it does pull out of that could, in theory, pull around the sensor that's down here, maybe giving you a false reading that the dressing is full when it's actually not. Does that make sense?
Yeah.
So best practice is to just point it north, just like you did right here. Okay? So this looks good right here. So next step is each dressing kit is going to have these kind of long, thin, basically Tegaderm strips. Okay? So what we want to do with these, and this is why we want the scissors, want to cut this. You don't have to do this, but it's going to make your life a lot easier. Okay? For the narrow edges right here, we can cut this in half, just like that. And then we're going to place it here and here, right? So once you do this, I know you're the guinea pig, sorry.
I guess.
So we want to go right up to the edge of the white here, okay? That's okay.
Okay.
Yeah, just like that. And what we can note here before you press this down is each end of it. See how the ends are rounded. You see this? Right? So I can actually demonstrate this part. So these rounded edges are not sticky. The reason being, when we pat it down just like so, we want to rub just on the edge to make sure it's all sticky, and then we take the non-sticky part, the rounded edge, and pull it off, and we're left with the strip. Make sense? Okay? So now that you've been fully educated, why don't we try this on the top one?
I'm nervous. Everyone's watching me.
You're doing great. You're doing great. Yep. And then, yep, just like that.
Yeah.
Easy, right? And then for the edges, we're just going to be thorough here. Now, because this is a longer, thin one, we can use the full length of it. So peel off the middle. Yep. Place it right up to the edge. And each side is going to have these little wings. Just pull it off. Correct. Yep, again, let's pull it off. That's it. And you see how we're left with the well, I mean, you can barely see it, but she pulled it off just, everything was great. So just to be thorough, just do one more, oops, sorry. So on the other side. Now, a common question I get is, do we have to use these? The answer technically is you don't have to, but highly, highly recommend it because it's going to help kind of bolster that vacuum seal. That's the whole point of this, right? Because it seals and then it compresses on the incision. No, you're fine. You're good. Okay, perfect. Now, I believe I might have an actual device. We're going to test how good of a job you did. Aha, I do.
Uh-oh.
So when we have the device just kind of, while we're changing it, it's going to be just kind of loose right here, right? So to reconnect it, do me a favor. Yeah, just twist it. Yep. And that's it. And this one, first batteries, make sure it's good. Okay, so let's see if we did a good job here. So then we just press this button, so it's going to be blinking with these two blinking in tandem, right? So assuming we did everything correctly, which I think it looks pretty good. Now it is normal for this to take maybe 30, 45 seconds. Sometimes it takes another, so after about a minute, if it doesn't catch a seal, it's going to be blinking orange by itself. That's actually, for the first time initiating it, that's actually normal. We actually got it this time, right? So we're good. So if it goes through a cycle and it's still blinking orange, that's okay. Just press this again, give it a few more seconds to kind of compress, catch that seal, and we should be good to go. But that's the long and short of it. You did great.
Yeah,
Yeah, you passed. Any other questions, comments, concerns?
So,
Yo.
basically when removing it, right?
Mhm.